I'm Anna. I'm an MA for Dr. Rob, and today I'm going to be describing what you would do to get a urine sample via catheter, and this will be a video for both male and female catheterization. So what you would start out with is you would greet the patient, wash your hands, identify yourself. So I would be saying, "Hi, I'm Anna. I'm an MA." And then you would identify the patient. So you're going to ask them, "Oh, hey, can you verify your name and date of birth for me?" And that's just to make sure you have the right patient, because you never want to do a catheter on a wrong patient. And then what you would do next is you would tell the patient, "Hey, we're going to do a catheterization today." And this is all assuming that you are talking to a patient who is alert and awake. If you have a patient who cannot respond, you would need to verify with the doctor that this is the right patient, and you would also need to verify with other identifiers as well, because you cannot ask them verbally who they are, and making sure that that is the right patient. So the next thing that you would do after you explain that you're going to do a catheterization on the patient and explain what the procedure will be, you would then ask them to disrobe from the waist down, and you would provide them with a gown. So I would say, "Hi, hey, I will need you to get undressed from the waist down, and we'll provide you with, we have this gown here for you." And then I would come back after they are in their gown and undressed from the waist down, and we would, for a female, get them into the dorsal recumbent position or the lithotomy position, and this is so that we have a best view of the perineum and the urinary meatus. You would also have a light ready so that you can see it clearly, so that you're not guessing where you're going. And then from there, you would place a drape over the patient's legs so that you don't have them you have them as least exposed as possible. And then the next thing you would do is, as you're going along, you're always telling the patient, "This is where I'm going to touch you," just so that they are aware, and you would verify that with them as you go along, making sure that they're not uncomfortable throughout the process. So for the female, we've already washed our hands. So the next thing would be to put on your sterile gloves. So you would have your sterile tray, which this is my sterile tray here today. And you're going to open your sterile tray, and this is what I'm going to be using as my tray, and my well, actually this will be my tray, and the other will just be an extra sterile spot for us. So what you'll do is get your sterile gloves out. They would be packaged unlike these ones, which I have on hand. So I'm going to be putting these sterile gloves on, not as shown here, because I don't have sterile gloves on me. So you would want to make sure when you're putting on your sterile gloves that you are not touching the ends, and you are making sure that you don't touch anything else to contaminate them. Also, with your sterile tray, you don't want to be talking over it, and you will also not want to be facing away from your sterile, any of your sterile equipment. So the next thing after you get your sterile gloves on is you will get your sterile field out. And with this, once you open it, I have both sterile gloves on, so I will be opening this and placing this under the patient's buttocks. And for this purpose, I am going to place it here. This is going to be my patient today. So I'd place the sterile field, making sure that I'm always facing it. And at this point, I still have both hands that are sterile. The next thing that I would do is get my antiseptic cotton swabs. And for this purpose, these are my antiseptic cotton swabs. And they would be standing upright. So I'm going to pretend I have this upright just so that you don't lose any of the solution once you open the package. In an environment where you actually had some sterile antiseptic swabs, they would be coming in a package, and you'd want to make sure that once you opened it that you kept them upright so that you don't lose any of the solution. So I have those ready inside my tray. The next thing I would do is make sure that I get my catheter ready. For this purpose, this is my catheter. And I'd set that down, making sure that neither side is getting contaminated. I still have sterile gloves, and then I would be using my lubricant to lubricate the end that I want to insert into the patient. And this is not how I would do it in the office. You would want your lubricant would come inside the sterile tray, and you would be able to spread that over your catheter, the end that you are inserting into the patient. The next step that I would take for a female is that I would let them know that I'm going to be touching their area, their genital area. So I would be letting them know that I'm going to be spreading apart the labia and cleaning the area before inserting the catheter. I want to make sure that we're always staying sterile. So you are going to use your non-dominant hand to spread apart the labia. So you're going to use your index finger and your thumb to spread apart the labia so you expose the urinary meatus. And then you will take your antiseptic cotton swabs and you will clean one area, discard, then grab another one, clean the other side, discard, and then you would go down the middle as well. So you're going side, side, and middle, and always going from top to bottom. And then once that is clean, you're still holding on to the labia, making sure that that is staying open, and so that you do not recontaminate the area. And once you, I should have mentioned beforehand, once you have your sterile, your non-dominant hand on the touching the patient in any way, it has become unsterile, and you cannot move it off until you have inserted the catheter and done the procedure itself, because we don't want you going back over your sterile field and contaminating anything that you have there. So the next thing that you would do once you have that the area cleaned is you will go back, or you will grab your catheter, which you have already lubricated. Well, once you've set down here, you lubricate it, obviously. So once you've lubricated, you will then use the one end to insert, and remember that you have one gloved hand that is still sterile, so that would be your dominant side, and you're going to insert it into the urinary meatus. And for females, that's about the urinary meatus is about I think it was 2 inches. So you'll insert it until you get urine. Don't go further than the 2 inches if possible. And then once you start seeing urine come out, you're going to switch your dominant hand from holding, or your non-dominant hand from holding the labia open, and grab the catheter. And then your dominant hand is going to direct the catheter the other end of the catheter into the sterile, or making sure that it's directing this flow of the urine from this catheter into the sterile collection cup that you have set within the tray as well. And once that is the amount that you are required to collect, then you are done with the device or the cup. Otherwise, don't collect more than any more than 100 or 1,000 milliliters. And that this is because that can cause spasms in the patient's bladder, and you don't want to cause them more pain than necessary. And once you are done with the collection cup, just set that aside, and you will then go back and take the catheter out and discard and set it to the side. And then once you're done, you will clean the urinary meatus with the sterile drape that you had already set down, and then make sure that the patient is covered again. And then you can go ahead and discard all of your supplies that you've used, the sterile equipments that you've had. One thing to note with the catheter is that you don't want to let it flop around or drop or touch any of the other surfaces while you are collecting, because if you do so, you have contaminated your catheter and you could cause the patient to have a urinary tract infection, which can lead to sepsis and furthermore death. So you do want to be very aware of where your catheter is, and that's very important while you are going ahead and prepping. So want to make sure that while you are preparing, that you don't contaminate your gloves in any way, and you don't want to contaminate any of your equipment. Coming to the male patient, what you'll do is you will, the only difference for male is that they have the longer urinary meatus, so you will be inserting it about 3 to 4 inches instead of the 2 to 3. And that will be, you'll be inserting the catheter first, obviously doing the same procedure of lubricating and everything from beforehand. So you're going to get out your sterile gloves, put those on, then grab the sterile drape, place it under the buttocks, making sure not to touch the area so that you don't contaminate your sterile gloves. And then you'll prepare your equipment. So you'll get your catheter ready, you'll set it out and get the lubricant placed on it, and the antiseptic swabs. You'll use those again, or not again, you will set those out for the male patient, making sure that you have it upright again. And then you only want to collect again only at most the 1,000 milliliters. And this is again because you can cause spasms for the patient, which can be very painful. So you want to be very aware of that. With the males, you are going to expose the urinary meatus. So you're holding the head of the penis and you are exposing the urinary meatus, and then you will do your cleaning in a circular motion around. So you go swipe around the, you're going down the sides. So you're going to do one swipe down one side, toss it away. Then you'll do another swipe down another side, toss that away. And then go to the other side as well. And then you will hold it with your non-dominant hand, and making sure that you're not letting go, that you're not touching anything else with your non-dominant hand as well. and then you will, again, insert the catheter, going very slowly, making sure that you're not going to, like, if there is a moment where you can't push it in further, don't try and force it in. You never want to force the catheter in. Once it's in, again, holding on with your non-dominant hand, you will grab the catheter with your non-dominant hand so that you have your sterile hand free to direct the other end of the catheter into the sterile collection cup. And again, you wouldn't place the sterile collection cup or you wouldn't, if it was a sterile cup, you would be placing it on, you could place it on the sterile drape, but you don't want to do so if it is not sterile. With the catheter, again, you want to make sure that you're not touching it to any other surfaces, and you're not letting it drag or drop around, because you don't want to contaminate your area and cause the patient to potentially have a UTI. And after you're done, again, set the collection cup to the side, take the catheter out, cleanse the area with your sterile drape, making sure that the urinary meatus is cleaned off, and then you would cover the patient again and ask them if they have any questions or concerns, and let them know when it will be processed, or when you have an expected time for when the results will come back for any labs that they are running with the urine sample. And then you will thank them and go on to your next patient. Thank you.